Hello everyone. So welcome to the second session, and in this session we'll be discussing the causes of depression. So over to you, sir.
Yes, so now we will discuss the causes of major depression. So the first and the very most important one is genetic. So
Okay.
people who have a parentage of parents having major depression earlier at some point of time in their life, they are 40% more likely to have major depression in their life. And first line of first degree of family members means brothers, sisters, like that. If a person is diagnosed with major depression, then their first degree family members, they are having a risk of major depression 2 to 4 times higher than the normal people. So it is a genetic. It can be a genetic thing also, but not necessarily only genetic. There is one stress diathesis model which states that it is not just because of the genetics the person is going to get major depression. It is also the amount of stress which a person is going to face in his or her life which will decide whether or not the person is going to have major depression.
This reminds me of your petrol example that you gave.
Which example?
So the fuel one, that the fuel has the tendency to burn, but if you keep it
Correct,
in the
correct.
safe space, so you can
Yes.
always protect it.
So since you know this example already, I'll give you a different example.
Oh,
Suppose, suppose there is a seed of some tree. So that's if the seed is kept in a bottle, will it become a tree? No, it won't become a tree.
yeah.
So, but if you plant the seed in a soil and give it favorable conditions like water, humidity, temperature, sunlight, then it is going to grow into a tree. So, having a genetic uh, 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 disposition does not guarantees having that a person is going to have major depression. Having genetic disposition only means that if the favorable conditions are presented to the person will develop major depression. This is what it means, not a guarantee.
Yeah.
So different example was better, I think. Yeah?
Yeah. So both examples are equally good.
Okay. So second is biological differences. It has been seen that the people who have had a major depression in their life, certain physical changes in their brain structure occurs. So in the brain structure undergoes some changes, but these change, what changes undergo, and how much they undergo, and whether or not they can be changed, these are uncertain right now. So if whenever understanding of the changes undergoing in the brain structure and whether or not they are reversible, this improves. Then probably by changing the brain structure also. So in our brain there are certain neurotransmitters which uh, which are responsible for our behavior and mood also. So these neurotransmitters, if certain neurotransmitters, if they are in excess or they are deficient, then there also can be a problem of major depression. So basically, when the medication part is taken care of in major depression, it is done like that only. Certain neurotransmitters they have to be increased, and certain neurotransmitters they have to be decreased, or the effect of certain neurotransmitter is to be enhanced and effect of certain neurotransmitters is to be decreased. So this is how brain chemistry works. Then the fourth one is hormones. So we have various glands in our bodies which secrete different hormones.
Yes.
This hormonal secretion also causes not the hormonal secretion, the imbalance in hormonal secretion causes major depression. For example, if a person, say thyroid gland, it produces thyroxine. If the thyroid gland is underactive, the person will be suffering from hypothyroid condition of hypothyroid. So that person is likely to suffer from major depression.
Okay.
So even after pregnancy, there are certain changes in the hormones of females because of which they can undergo major depression, that is called postpartum,
Yeah.
post POST PAR, PARTUM. So that is post delivery. They can go this major depression, and even during pregnancy also this can happen. So that is peripartum. If it happens during pregnancy, it is peripartum. So even during the not during about a week before the menstrual cycles, the females are likely to experience the fluctuation in hormones. Because of that, their mood can swing. So, but that is as soon as the period starts, it will get back to normal. So it won't be diagnosed as a major depression because the period has to be 2 weeks. So what I was trying to tell you, because of the changes in hormones, the mood can fluctuate and it can affect a person, and the person can undergo major depression. Then the fifth reason of major depression is substance abuse. The people who are, say, alcoholic, major alcoholic, very highly dependent on alcohol, or people who are, say, taking drugs like cocaine, ganja, hashish, afim, those who are addicted to this, they also are likely to be diagnosed with major depression.
They are
And
prone
then,
to major depression.
yes, they are prone to be. Then the sixth one is traumatic experiences. So traumatic experience is a subjective term, because if one incident which is traumatic for me may not be traumatic for other person. Say for example, in my previous profession, I was very used to seeing people around me dying for various reasons. Not very uncommon for me, but for a normal person, it can be a very, very devastating experience.
Death of loved
Okay,
ones also.
so it depends on your conditioning also, it depends your personality also. But there are certain incidences in life which are considered to be traumatic irrespective of the person. For example, death of near dear ones like mother, father, brother, sister, husband, wife, a very close friend.
Yes.
So their death is considered to be traumatic. For example, child abuse, traumatic experience no matter what. For
Yes.
example, rape, traumatic experience no matter what. So the traumatic experiences also causes, are also likely to cause rather a major depression. Seventh thing is medical condition like, say, cancer,
Yes.
or any
Chronic
like
disease.
yeah, thalassemia or hypothyroidism, I give an example. So these medical conditions also can cause this major depression, because the person gets tired of his medical conditions or medical condition. Then the eighth one I have already told earlier, the medication. There are certain illnesses, the medication of which causes major depression. Eighth reason is environmental. The kind of environment we are having around us is also a factor. So if the environment is always stressful, again, we have to have understanding of stress. All the stresses in life are not bad. There are certain wanted stresses. There
Yes.
are certain unwanted stresses. The wanted stresses are termed as eustress, and the unwanted stresses are termed as distress. So I'm talking about distress. So when we conduct a session on stress, we'll discuss this in detail.
Bad stress
So
also we can call it
yes,
in simple terms. Bad stress.
yeah. So the stress which is causing harm, if it is there in the life for a prolonged duration, then also a person can undergo major depression. Then the 10th factor is personality. I told you, depends on the person. Somebody can take anything very lightly, and somebody can take nothing lightly.
Yes.
So it like neurotic personality. If the person is having neurotic personality, he or she will get disturbed or agitated or concerned about even the minor things in life, which are nothing kind of things. So if the person is having neurotic kind of personality, he or she is more likely to have this major depression. Okay. Then support system is also very important in life. If a person is having good support system around him, when I say support system, it's a holistic term, not a single factor. It includes, say, supportive parents. If a person is married, supportive spouse, supportive siblings, supportive friends, availability of psychiatric help. these all constitute society, these all constitute support system.
Yes,
So
sir.
if the good support system is there, then there is less likelihood of a person developing a major depression. But if one or more of the factors in the support system are not so favorable, then the person may develop major depression. So these are the
I
causes.
think the school environment, the college environment, teachers, and the peer group also has a lot of impact.
Definitely, definitely. So these are the factors which can cause. I never said they will cause. They can cause major depression. So we have covered the causes part. So
Okay,
this
sir.
part is
So I just one question if we can cover it now.
yes, yes. Go ahead.
So when we have hormonal changes in our body, so which can lead to depression. So are there also any physical changes that we can see on our body, which can be like a signal that there's a problem with our hormones and we need to consult?
It, it, it depends which kind of hormone are deficient. Each hormone is having different effect.
Yeah, right.
Like for example, if the person is having say hypothyroid,
Hmm.
the thyroid gland is underactive. So then the person will start gaining weight. But if the thyroid gland is overactive, then the person will start losing weight.
Okay.
So each hormone is having different impact.
So we need to be conscious about what's happening in our body also.
Yes, if you see
Mental
any
and physical health
if you
management.
see any major changes, like you see many females, they have a problem of water retention before the periods. So that is something they can easily understand. This is because of the forthcoming date. This is happening. But if that is not the cause, after the period it is happening, then it can be something else. If the water retention is a general phenomena happening with that female, and she knows it's a normal thing, it happens every time that date is coming. But if the phenomena is occurring post the dates,
Hmm.
and there is no valid reason for that,
Hmm.
then there is something to worry about. So
Yes.
it depends on the body type, also the tendency of the body, what is the normal experience of the person about himself or herself
Hmm.
during that particular period. So many factors are involved. So it is better if a person is having any doubt about that, consult a doctor.
Definitely. So thank you so much for making us understand the causes of depression, sir. So this was the second segment where we have discussed the causes of depression in detail. Thank you.